Hi, in today's video we're going to be talking about your thyroid. So there are a lot of things that I did not get taught in medical school, that no one told me about my thyroid or about thyroid health, and I had to learn it when I was forced to learn it. So I'm ready to share that with you. So we're going to start out just talking about the gland in general. We don't really think much about it. It's a butterfly-shaped gland. It sits right here in your neck, and it produces the hormones predominantly T3 and T4, which are the main thyroid hormones. The T is tyrosine. It's an amino acid. The number is the number of iodines. And we can go ahead and live our lives feeling amazing with no concern and no regard, not paying any attention to this gland. And then out of the blue, we can start having issues. So the classic signs and symptoms of an underfunctioning or overfunctioning, because it can go either way, and I see it in my practice every day, either way, thyroid, are troubles with metabolism, whether it's being cold all the time or weight gain, or on the opposite end, it's heat and a lot of weight loss and palpitations. You can see things like absolute bone-crushing exhaustion, puffiness, hair loss, again, cold intolerance, constipation, or the opposite side when you see the gland go hyper. So this little gland is involved in many, many, many things in the body. And what happens with a large number of the population, this is what I want to make sure people understand. This is an overlooked crisis. It's now in 1 out of every 4 to 5 women that has this issue. It is more common in women than men, which we'll talk about in a second. And part of why it is so overlooked is that your traditional practitioners are not ordering the right blood work. So when you go to most doctors, you will get a thyroid stimulating hormone level and maybe a T4. And those are very basic screens that you should be getting at least yearly through your practitioner. But the truth is, thyroid problems can start much before those two numbers have an issue. And if you do a broader look at thyroid levels, you're more likely to catch that. So very often what happens is the thyroid problem can actually be an immune-mediated problem, meaning that it's not even a primary problem with the gland. It's a primary immune system issue. And what that means is that your body starts attacking the gland itself. And when it does that, it can either present hyper, as I discussed, or hypo, which is slow, so fast or slow. And we believe that part of the reason why this is so common is that thyroid antibodies, so your body makes these antibodies that attack the gland, is because many toxins in our environment actually resemble thyroid tissue. This is a very interesting concept. Many environmental toxins look like your thyroid. So the body gets confused, and when it makes antibodies, because that's a normal response when there's an invader, being the toxin, that the body makes antibodies to go after it. Those are like the soldiers. Well, if the toxin looks like the thyroid, you've made a bunch of soldiers, the body gets confused, you start attacking the actual gland. So with that happens when you're attacking your actual gland, that's where the problems start happening, where you can get Hashimoto's or Graves'. So what we want to do in the healing journey is to address that first. Find out, first of all, by making sure that when you go for your labs, you're getting antibody levels tested. So those are TTG antibodies, which are thyroglobulin, and TPO antibodies, thyroid peroxidase. So we'll list below the blood work you should ask for. But if you catch this early, and I do in a lot of patients that don't have thyroid issues, I'll order a broader panel. And if I see a rising antibody level, but the patient's still feeling good and the thyroid numbers themselves look good, we can intervene very often way before any clinical symptoms present themselves. This is also, by the way, why I like muscle testing, because I can find issues or subtle issues with your thyroid just by doing the muscle testing when the labs don't show anything. So remember, there are ways to test this ahead and stay ahead of time, where traditional medicine is waiting. And this is the problem with traditional medicine in a lot of ways. We wait to put things in a box. This is a problem with rheumatology, an entire field of autoimmunity, where we wait until things fit nicely into a box. And the truth is we could have caught something way sooner if we had taken action, or if we had used muscle testing or maybe some other broader blood work that could have shown a problem prior to it happening. So in order to fix this, and that what I would suggest first, like I said, is being a little more aggressive in your own journey with getting the blood checked early. If you're suspicious of symptoms especially, potentially things like an ultrasound can also show, which doesn't have radiation, can show if the gland looks overactive, if it's enlarged, if there's nodules. Those can all be signs that there's immune or reactivity going on in the gland. So that's the first step, is kind of diagnosing it. Then as we treat, if you have antibodies, the first thing you want to do is go after healing your gut. So really working on getting leaky gut healed, looking at, do you have yeast, bacteria, parasites, which most people do. If you've never really aggressively worked on your gut, if you have leaky gut, you're much more likely to develop autoimmunity of all types, and the most common is Hashimoto's, and Graves seems to be rising since the pandemic as well. So work on your gut aggressively. You want to also look at your diet in general. There's a lot of data, and you can just Google on or search PubMed on gluten and autoimmune thyroid. So glyphosate, which is the main issue we see with gluten, triggering an autoimmune reaction. So get that out of your diet. Just cleaning up the diet very often, taking gluten out, minimizing dairy, working on seed oils and processed food. I will see patients' autoimmune titers almost completely come back to normal. And as an aside, if you do see a traditional doctor and you have elevated titers, this is what happened to me. The endocrinologist told me, well, yes, you have elevated TPO antibodies, but which, by the way, mine were greater than 1,000 at diagnosis. But we're not going to check that again because that doesn't change. That was the advice I got. We're just going to work on your TSH. And at the time, I was having severe thyroid eye disease. So I didn't listen. I went and found a naturopathic practitioner who now works with me, and we got my gut healed. I went off gluten immediately, and I tracked my antibodies, which, by the way, I'm proud to say now hang around the 50 to 60 range. They were, like I said, potentially even over 2,000. The lab cut off. That's how high they were. So yes, you can not only diagnose, but you can also follow how well your treatment's doing by looking at those antibody titers as you move on. So you want to go after the secondary causes. Again, dietary, processed food, gluten, dairy, get your gut healed. And then there are also viruses that can trigger the thyroid. Everything from reactions to certain jabs to chronic fatigue type viruses. Those things need to be addressed. And there are ways with functional medicine to both diagnose and treat chronic viruses or chronic infectious pathology. So working on that, opening your detox pathways, making sure that you work on getting toxins out. The other big thing that I've seen involved in thyroid can be heavy metals. So if you have fillings, or if you do a heavy metal scan or screen just to make sure you don't have, let's say, high levels of lead, arsenic, or mercury, getting those out can really help calm down the thyroid. And then one last point that I can't stress enough, and the reason why I believe we see this more in women is because of chronic stress. So chronic stress obviously throws off every disease, but especially in the setting of the thyroid. So if you pay attention to where the thyroid's located, it's right by your vocal cords. And I believe, and we have reason to believe, that this chakra, the throat chakra, energetically, in many women especially, but in men as well, has been clamped down. We've played small. We've accepted a role of playing small to not make others uncomfortable. We've accommodated. We've people pleased. We've kept our mouths shut, literally. And that slows the energy flow to that area, making the thyroid more likely to become inflamed and to be a location of disease. So anyone who's truly ready to heal, you must work on finding your voice, finding your authentic self, getting in alignment, becoming sovereign, saying things. And you don't have to suddenly start speaking everything loudly. You can start gradually. Just gradually speak when you were historically staying closed off. Say what needs to be said. If you do that, your healing is going to be that much faster. So I hope this video helped. If you or someone you love is struggling with thyroid or you think they might be, remember these tips. Get appropriate blood work. Look for a practitioner that can help you uncover the root causes, because this is often not a primary thyroid problem. Make sure that you get the right treatment. And we didn't talk a lot about that, but the right treatment may involve desiccated thyroid, a combination of T4 and T3. Sometimes it's enough to treat with nutrients and minerals and detoxify, things like iodine. And sometimes some glandular thyroid can be enough as well. You want to make sure you're taking care of your stress gland. Your adrenals often need a little support, and your mitochondria. And as you reclaim yourself, you're going to find you can reverse this. In my practice, we have helped to reverse thyroid, even pretty severe things like aggravated Graves' disease, significant Hashimoto's, over and over again. So I hope that this was helpful, and I hope to see all of you in the next video, and I hope you have a wonderful rest of today.